I know that 1 in 4 people suffer with a mental health condition during the course of a year, so it is so common. And when the opportunity came up to train as a mental health first aider, I just jumped at it.
I wanted to become a mental health first aider because mental health is something that I struggled with previously in the past. So I wanted to make sure that I was really equipped to signpost people into the right directions and give people the right advice when they're kind of the most vulnerable.
Individually, I became a mental health first aider to give me the right skills to support people, but from an organisational point of view as a HR leader, I feel it's important to recognise mental health in the workplace and ensure that we're giving the appropriate support across the business.
So I became a mental health first aider through work. They had told me there was an opportunity and I thought it was perfect to fit with my role. So I did mine completely remote. It was over 4 half days.
There's an accredited, internationally recognised course that you can do. I did mine over 2 days in person, but I know that you can also do it virtually. They also offer refresher training every 3 years, so much as physical first aid, you can do a refresher to keep your training really current.
I took part in a 2-day course through work. During the course I was able to learn about mental health and how to apply it in the workplace in terms of supporting people, and also I got the perspective of different organisations and different people across different sectors.
As an MHFA, you're expected to be a friendly face, somebody that can be approached if you're struggling, to provide advice and to signpost people in the right direction so they can get the most appropriate help.
My role as a mental health first aider is to offer support and guidance, not to advise or diagnose.
We're not there to be a therapist or a counsellor. We are there to provide non-judgmental listening and to provide signposting advice.
But also just to be a confidential ear if they just want to have a cup of tea and a chat. I think it's quite nice for our colleagues to know they can come to people who can understand and kind of guide them towards the professional support that they may need.
For some people it can be really intimidating to approach somebody and talk about their mental health. So as trained MHFAs, we look out for the signs that somebody is struggling and will be confident to approach them to ask if they're okay.
So as a HR leader, these conversations tend to happen naturally, but I'm more than happy for people to reach out to me via Teams, go out for a coffee or email me, whichever is comfortable for them.
We have a dedicated area on the intranet with all of their contact details, so it's really easy for our colleagues to find the right person they want to talk to. Whether that's putting a meeting invite, I don't even mind if someone doesn't even put the title as anything mental health. They can put the title as anything they want and then just catch me for a cup of tea and speak confidentially. I think having mental health first aiders in a business is extremely important because talking is a first step of anything when it comes to mental health and mental well-being, and allowing colleagues to support other colleagues is really important because it gives that first stepping stone for them.
Having MHFAs in your workplace can also provide another outlet if somebody doesn't want to talk to their line manager. It gives them another option to go to.
Mental health first aiders is really important because it raises awareness of mental health across an organisation and it provides the appropriate support for colleagues.
Having MHFAs in a business can help to reduce the stigma that's often associated with mental health. It can also demonstrate that it's okay not to be okay.
So having mental health first aiders in any organisation is helpful, but it can't be done in isolation, so it has to be a part of a wider wellbeing programme or a wellbeing strategy.
Businesses can implement mental health first aiders into the workplace by just starting that open communication and not being afraid to talk about mental wellbeing.
So making sure that they're communicated about regularly, that people are clear what they're there to help with and what they can do to support. In addition, things like National Awareness Days relating to mental health is a really good opportunity to discuss the fact that you have mental health first aiders in your workplace.
It's important to have the exec leadership on board with this, have colleagues aware of what mental health first aid means and how it's attributed to the wider wellbeing strategy.
Research is always changing, and learning what the new ways of understanding wellbeing are so important. So just making sure that they're always on top of that up-to-date refresher courses and really just opening communication around the business.